Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Ahead of coronavirus vaccine arrival, Kaduna State government to procure drones to aid vaccine distribution. COVID-19 task force in Abuja stops examination by the Nigeria Social Insurance Trust Fund for disobeying coronavirus safety protocols. And AstraZeneca works on vaccines against coronavirus variants to be ready by September. And there are over 3.5 million confirmed COVID-19 cases on the African continent, with more than 3 million recoveries and 91,000 deaths cumulatively. Last night, Nigeria recorded 1,634 new cases and 6 deaths reported from 25 states and the Federal Capital Territory, with Lagos, Anambra, the FCT, Rivers and Abuja recording over 100 cases. This leaves the total number of confirmed cases to date at 1,033,552 cases, out of which 107,551 have been discharged, with community recoveries in Lagos, Kaduna and Kano totaling 867 in 24 hours. According to the NCDC, home-based care is to be provided by a designated caregiver to COVID-19 patients with mild or no symptoms and with support from trained health workers. The center said that patients and caregivers must adhere to infection prevention and control measures to limit transmission. Now, the governor of Benue State, Samuel Ortom, has resumed his duties 7 days after testing positive to the coronavirus on the 27th of January. Following a second test, which returned negative on Monday, he expressed his gratitude to members of his team.
I give glory to the Almighty God for what happened to me about a week ago when, on my own, I decided to go for tests for COVID-19 after a series of my aides were positive. And unfortunately, I was positive. And I decided to isolate myself. And by the grace of God, yesterday, when a repeat test was done after my medication, I was negative. And so I am negative. Let all of you not be afraid that I will contract it to you. That will not be your portion. And so I'm here today to appreciate the Almighty God, appreciate the Deputy Governor and members of my council who have held forth on my behalf, ensuring that things work well. We were still running government together because on visual, on telephone, on chat, on WhatsApp, and text messages, we were able to communicate to ourselves. And I thank God that things have gone on very well during my absence.
Well, let's head to Kaduna State, where ahead of the arrival of COVID-19 vaccines into the country, the state government has signed a memorandum of understanding with an American firm for the procurement and deployment of drones that will enhance prompt and safe distribution of vaccines and other medical consumables to the remotest part of the state.
The COVID-19 pandemic has had an adverse effect on the nation's healthcare sector. Significant impact has been felt in the distribution of drugs and medical supplies to affected areas, as well as in the transportation of test samples to laboratories and treatment centers. The Kaduna State government is now leveraging the use of drone technology to overcome some of the challenges associated with drug distribution. The state signs a memorandum of understanding with a private drone manufacturing and deployment firm, Zipline International, at this meeting. Governor Nasir El-Rufai believes that the distribution of the expected COVID-19 vaccines and other medical consumables during health emergencies like the COVID-19 pandemic can be improved upon through the application of effective automation, artificial intelligence, and robotics.
We have very good cold chain equipment in the state that has helped us in our vaccination against polio. But in addition to this, the coming into Kaduna State by zip line and selecting us out of 36 states of Nigeria to pilot this project is really a great privilege and honor.
Apart from enhancing the state's healthcare system, the Kaduna State government and its partners say the new technology will also create more jobs.
The architecture that we already have of primary healthcare facilities in every ward, zonal cold chain facilities, and other infrastructure for health will be greatly enhanced once we get this up and running.
We believe that by going on this journey as the pioneer state that we are working with in Nigeria, this would actually be the epicenter of drone technology and drone innovation, and people to see how using drones you can actually bring goodness to the people.
The proposed procurement of drones for distribution of pharmaceuticals to all parts of Kaduna is novel and will no doubt bring far-flung areas within reach.
In a race to end the pandemic, over 104 million doses of the approved COVID-19 vaccines have been administered so far globally. But less than 2 million doses of these vaccines are being administered in Africa. Global health experts have warned that Africa will be the last region to get enough supplies of the doses of the much-needed vaccine. Now, let's find out how Nigeria is doing in getting them. And joining us from Abuja studios is Dr. Faisal Shuaib, as the Chief Executive Officer of the National Primary Healthcare Development Agency. We'd like to welcome you to the program. Many thanks for joining us. Tell us, what day is Nigeria expecting the COVID-19 vaccines? I'm asking this because we've asked representatives of governments and also from your agency, and the last we heard was towards the end of January. And then again, we heard sometime first week in February. But we know like countries like South Africa, for example, said February the 1st, and they have received their first million doses. So what day is Nigeria expecting the vaccines?
Right, so Nigeria is one of 92 economies that's plugged into conversations with the COVAX facility, which is an entity that is led by the World Health Organization, focused on how low and middle income countries like Nigeria can access COVID-19 vaccines in a fair and equitable way. So the last communication that we received from the COVAX facility is that we'll be getting about 16 million doses of the AstraZeneca vaccine in the month of February. The Presidential Task Force on COVID-19 and the Federal Ministry of Health, we rely solely on communication from COVAX before we in turn communicate to the generality of Nigerians, so that we're transparent about all information around the COVID-19 vaccines. So a few weeks ago, the information we got from COVAX facility was that we will be getting these vaccines by the end of January. But because there were supply challenges with the Pfizer plant, they were trying to upscale their global plans to increase production of their vaccines. So they suffered a delay, and that made it impossible for them to deliver by the end of January. But we've now moved beyond the 100,000 doses of Pfizer that we're supposed to get in by the end of January. Now we're getting up to 16 million doses of the Oxford AstraZeneca vaccine. This is, of course, much, much better than the 100,000 doses, which was grossly inadequate.
We're not expecting the Pfizer-BioNTech vaccine at all. What we're to expect is the AstraZeneca vaccine.
So in the month of February, we're going to be getting 60 million doses of the AstraZeneca vaccine. But of course, we're also discussing with the African Union that has made available 41 million doses of COVID-19 vaccines to Nigeria. This will be delivered by the end of March or April. And the information that we have from them is that they will be providing the Pfizer vaccine, about 7 million doses of Pfizer vaccine, about 16 million doses of AstraZeneca, and about 18 million doses of the Johnson & Johnson vaccine. This is the provision that they've made for Nigeria. So we at the Federal Ministry of Health and the Presidential Task Force on COVID-19 are having multiple discussions just to make sure that we get vaccines to Nigeria as soon as possible.
And when you mentioned through the COVAX initiative, is Nigeria paying for any of the vaccines?
So through the COVAX initiative, the COVAX facility will be providing enough vaccines to cover up to 20% of Nigeria's population. This is going to be completely free. So COVAX will provide the vaccines free of charge. But of course, even after procuring the vaccines, there's the bit around making sure that they are kept in the right temperature, that the logistics, the human resources to actually deliver the vaccines and the infrastructure are available to make sure that the vaccines get from the national level to the individuals that will get the vaccine. All of those logistics and deployment requirements will not be covered by the COVAX facility. The federal government will have to use resources, domestic resources to pay from that. Of course, this will be done in collaboration with the states. So 20% for the vaccine free, but logistics, transportation, human resources, all of the operations, that will have to come from the government of Nigeria.
If we're deciding to expect the AstraZeneca vaccine, do we still need as much the ultra-cold storage facilities, which a few states have been getting?
So at this point, you know, we live in an environment of COVID-19 vaccine supply that is dynamic. You know, it's a situation that is evolving. Right now, one thing that we've been assured of is 60 million doses. But we also are aware that the COVAX facility has a portfolio of multiple vaccines, right? Multiple candidate vaccines. So we have the Pfizer vaccine, the Moderna vaccine, the AstraZeneca vaccine, and there are also conversations around the Sputnik V vaccines, right? So for us in our conversations, we have to look at whatever vaccines are safe and effective for Nigeria. If, for example, NAFDAC approved the Pfizer vaccine, of course, we're going to take the Pfizer vaccine and keep them in the ultra-cold chain system that we have. We've already applied for the African Union's 41 million doses. Well, we're in the process of applying for the African Union's 41 million doses, and that also includes Pfizer vaccines. If we get approved for those vaccines, then we're going to be using the ultra-cold chain system. But I want to tell you that it is a space that is evolving, but as the information becomes available through to our declaration that we're going to be transparent and accountable to all Nigerians, we'll provide the information as soon as we get them in terms of the doses, in terms of the types of the vaccines, and when these vaccines will be available.
And hopefully you'll join us again then. We appreciate your time. Thank you very much, Dr. Faisal Shuaibu, Chief Executive Officer at the National Primary Healthcare Development Agency. Thank you for joining us on the program.
Thank you for having me.
What happened was that a man was to be arrested. The directors, they escape arrest.
When
they escape
one
arrest.
of the police officers collected somebody's phone.
Somebody escape arrest, stay defense, escape arrest from defense. You're telling me to stay here?
These are the scenes as the FCT Ministerial Enforcement Task Force on COVID-19 stopped on an ongoing promotional exams of members of staff of NISITF for violating COVID-19 Health Protection Regulations Act 2021. The head of Publicity and Enlightenment of the FCT Ministerial Task Force on COVID-19 claims that those in charge of the exams absconded, leaving their cars behind, which were towed by vehicle inspection officers.
We have been inundated with so much calls from staff of the NSITF in the past 3 days that they have been called in for a promotion exam. And from what they understand and the number of people coming, they are into some thousands. And they will not be able to ensure overcrowd. They won't be able to check overcrowdedness. So we should please ask them to postpone the exams. So we, on our own, we are a little bit more careful, knowing that the NSITF is a respected government organization and they should do what is needful. This early morning, we got so much complaint. Our chairman, the commissioner of police, got so much complaint. Some of the staff came to some persons, not staff, some persons came to the Eagle Square where we were sitting to come and lodge some complaints with so many pictures and videos of overcrowdedness. So luckily, as we are coming here, all of you, the journalists, followed us, and you saw what we saw. They claimed that they had permission, and we told them, okay, if you got permission, please show us the permission. They couldn't provide any permission. There was overcrowdedness. So we asked them to please kindly disperse and go home.
Still ahead on the program, we find out about the COVID-19 fight in Adamawa State. Do join us again. Number of cases, COVID-19 cases in Adamawa State. The state's primary healthcare development agency, in conjunction with UNICEF, has embarked on a rally against the spread of the virus in the state. The rally is part of enlightenment and awareness campaigns on the use of face masks in the local government areas of Mubi North, Mubi South, Yola North and Yola South, being the cosmopolitan city of the state.
Informed the presidential order on the use of face masks in public places. Despite this development, Adamawa State still battles with non-compliance to the NCDC protocols. As part of its response to stem the spread of the virus, the Adamawa State Primary Healthcare Development Agency, in collaboration with UNICEF, is commencing a sensitization campaign in the markets and other public places. Activities at the Jimeta shopping complex attest to the need of this campaign as people go about their business disregarding COVID-19 preventive measures.
Everything is for purpose. As for now, it's compulsory we all must wear face masks because of the disease that is moving around.
What I will tell Nigerians is, they should be putting their masks anytime they are entering markets, shops, hospitals, and other ministries.
An official demonstrates the hand-washing experience to illustrate its importance to the people and the need to abide by it.
As you can see, only maybe I can say 20% of the people are wearing face masks. About 80%, they don't wear face masks. They are just roaming about without wearing face masks. So we are here to create more awareness on the importance of the use of face masks to the community.
The president has said he has signed into law that anyone that did not follow the COVID-19 precautions shall be dealt with. That you have to follow all preventive measures on COVID-19. If not, you pay fine or 6 months imprisonment.
It has been observed that in the state, now when you visit government establishments like the Adamawa State Secretariat, the Federal Medical Center, state specialists, you discover people are wearing face masks or they are being forced to use face masks before entering into these premises. But it's been observed that in the markets, religious institutions, they don't use face masks.
With the measures put in place by the federal and state governments in mitigating further spread of COVID-19, the organizers expect that this exercise will reinforce necessary precautionary health measures to help in tackling the spread of the virus.
Mr. Bashiru Ahmad, the Secretary to the Adamawa State Government and also Chairman, State COVID-19 Containment Committee, joins us right now. Thank you for joining us on the program.
Thank you very much.
Are there plans to extend the Enlightenment campaign, which we've seen in a few local governments in Adamawa State, beyond some of the high-risk local government areas, the remote parts, for example?
Yes, definitely. For now, the campaign is concentrated in these three local governments, Mubi North, Yola South, and Yola North, because these appear to be the epicenters of the pandemic so far in the state. These are areas where we have very high numbers. So we are launching this campaign in these three locations, believing that if we're able to get it right in these three locations, then it will be easy to cascade the campaign to other local governments. But that does not in any way mean that we are not already in those local governments. The sensitization and awareness campaign is actually taking place in practically all the local governments as of now.
With that ongoing, how often is the state testing for the virus, especially with the second wave and then the threat of the variants of COVID-19?
I can tell you that we have recently ramped up the testing, and on the average as of today, we collect samples at about nearly 2,000 a day across the state. So this has raised the number of the samples we collect for testing. But I must say that the capacity of the laboratory that we have doing the testing is nowhere close to the samples that we collect. In that case, we have to actually be sending some of our samples to as far as Abuja to help do the analysis to avoid contamination technically.
Are there plans to perhaps locate more laboratories, for example, in the state, or are there collection sites as well across the state?
There are collection sites. In every local government, there is a collection site. Where as to increasing the number of laboratories, right now we have finished getting set for the installation of additional equipment at the specialist hospital in Yola right here. That will be the second testing center in addition to what we have right now in the Federal Medical Center. So we hope that in the next 2 weeks, we'll be able to get the lab in the specialist hospital up and running because the equipment is already on ground. All we need to do is prepare this adjustment that is necessary to be done in the building.
And finally, just before we let you go, are there home-based care taking place in Adamawa State? Because according to the NCDC, your state is managing about 363 persons as of now.
Oh, yes. Home care management has been with us since the first stage of this disease. This second stage, because of increase in the number and also because of high number of asymptomatic patients, it's only those who show critical signs that we actually admit into the treatment centers. Most of the patients are actually isolating at home by themselves. I must say that at this stage, many of the asymptomatic patients know what to do. So in most times, they're even allowed to just send information to the surveillance officers while they are in isolation at home.
All right, let us hope indeed that that is true. We would like to thank you so much for joining us on the program, Mr. Bashir Ahmed, the Secretary to the Adamawa State Government and also the Chairman State COVID-19 Containment Committee. Thank you for joining us on the program. Now, a coronavirus vaccine to tackle the new variants of the virus could be ready to be deployed, and this is by Ortom. This is coming from the team behind the Oxford AstraZeneca jab. Professor Andy Pollard from Oxford University said they were already planning to tweak the vaccine, and this is as some 10 million people have now received their first dose of a coronavirus vaccine in the United Kingdom. Well, you can take a look at our website, channelcv.com. It has the latest updates on the pandemic. All you need to do is log on and access news in health, politics, business, sports, and stories from around the world. That's the program this evening. Thank you for watching. I'm Melissa Ntumoka. Continue to take responsibility.